Right, thank you. So I was asked to speak to this group from one of the members of the enTECH group who happened to be a student last year working in cardiac rehabilitation. So he sort of said to me, maybe you could explain how the programs are developed, so what we've done to get to where we are today, and I'll go through that. And then secondly, as a topic, just to talk about some of the soft skills and professionalism when working with chronic conditions. And the focus, of course, on most of our program is on aging, hence this may be of interest to a lot of you. But I would sort of entertain you asking a lot of questions, just sort of to break it up, so it's not quite a lecture style. Okay? All right, to get started then, so I do represent the Center for Community, Clinical, and Applied Research Excellence, known as CARE. And we are now located at the Toby Jenkins Gym, as well as the Manulife Wellness Center, which is right next door to Starbucks. Okay. So with the generous donation of the facility, so the Toby Jenkins family donated it, we were able to now expand our research interests, our programming, and with a particular emphasis to tie them together and to advance technology within our programs. I think was mentioned then, we have not only this is the fitness staff, we'll call them. This talk will be certainly on the exercise component. Okay. So exercise and wellness programs for people living with chronic conditions and with the treatment side effects across the aging spectrum are the focus of our programs. As mentioned then, Hearty Hearts has been around since the early 70s, before you guys are even around. We serve the Kitchener-Waterloo community as a phase 3 or community-based cardiac rehabilitation. For many years located at the basement of the Grand River Hospital in the gymnasium, and most recently moved to the Research Institute for Aging down at the Schlegel Village complexes. So I did that as an undergrad, like many people here maybe volunteered for that program. And then as time progressed and moved through, when we had the opportunity with the Manulife, was to develop some programs within our community. So I'm going to talk to you a little bit about WellFit, because that's sort of our flagship program right now, and how we started to develop that program and things we took into consideration. Teens in Motion is, this pointer doesn't work, so. Teens in Motion is an exercise program for overweight and obese teenagers. The idea there is to try and integrate them into physical activity to improve self-esteem. So that would be the one program that we're not really focusing on aging, but certainly a program that we're very proud to offer. STEPS then stands for Structured Exercise Post-Stroke. So now in the last couple of months, we've ventured into providing an exercise program for people who are recovering from a stroke, but are certainly down the road from their initial event. Okay, so that's why it's post-stroke. It's not the acute care that they'll get in their hospitals. Okay, so program development, what's involved? So for every program that we've developed, I'm going to use WellFit as the example, and this is a cancer and exercise program. We did the research to understand what the chronic condition was. So what is cancer? Okay. What are the treatment for it? And along with that, what were the treatment-related side effects? When we started this, it was very novel in Canada and in the States. So we were sort of first to step into this realm and do some research and develop the program. But basically, it was a time when Lance Armstrong was still very active and touring, and he was fighting cancer at the time. So it sort of gave the idea that maybe exercise is beneficial. So with that sort of in mind, then we did take a look to see what the relevant literature had said, and found that there was one program in the Ottawa area that was working on this as well. In any event, we didn't have guidelines, but we drew upon things from our background, which would be cardiac rehabilitation, guidelines for osteoarthritis, guidelines for diabetes. Those that were fairly established, we sort of drew the information. So the one thing I can tell you is that people that come with a cancer diagnosis have many comorbidities. So we're not just dealing with cancer. But from here on, I'm going to talk a little bit about the specifics of that. We need to find out how and when we should assess them, and then what type of programs we should develop. In doing that, then, we established a structure. And, again, it was trial and error. But anyways, we started off thinking we're going to keep a very small group, see how they respond, see what it's like to interact with them. And this is where we sort of gained our knowledge with sort of the soft skills and professionalism. So we need to establish how or who we're going to have in here. Do we have people in treatment? Do we have cancer survivors? Do we have people that have advanced cancers, palliative? So we decided, well, why not start with people who are in treatment and keep it at that? So once we've established that, we needed to connect with our community partners. And in our case, it was the Grand River Regional Cancer Center. Okay. So here's a list of benefits of exercise, which I'm sure you've heard multiple times. So by looking at that and then considering what were some of the side effects of cancer treatment. So you can see they're quite extensive. One of the biggest ones is that cancer patients are very fatigued. Okay? We know that there's hair loss and they're susceptible to infection. Okay? Because the treatments target cells that replicate really quickly. So that would be the red blood cells, white blood cells. So there's always a situation where they're going to be faced with significant number of really treatment-related. Okay? So you can see lymphedema is swelling within one of the limbs if they took away the lymph nodes. Very common in breast cancer patients. Memory or concentration problems. Not sure exactly what it is. They call it chemo brain. But they're not very, they have memory lapses. So we learned that very quickly. There's people at the door, I don't know if you. Nerve problems. The chemotherapy and the radiation tends to destroy other tissue. It's not very specific. So you can see we have quite a list of side effects. So we have the cancer treatment, and the cancer treatment side effects that are all going to affect the quality of life of a participant. Oops. Okay, so putting that all together, the knowledge of the effects of cancer, its treatment, with those of the benefit of exercise, we were able to translate some of this information into practical applications. Okay? And that helped us determine the best exercise program based on the knowledge available. All right, so the side effects of cancer, depression and anxiety, that's going to come along with all chronic diseases. At least 25 to 30% of our participants suffer from depression. Cardiovascular function, you may wonder, okay, how is that affected? The actual chemotherapy actually destroys some of the heart tissue as well. So there's cardiac toxicities. Loss of muscular strength, possibly related to inactivity, possibly related to the treatment effects itself. Alterations in the muscle or fat ratio. So some people are very overweight, and that's probably part of the reasons of developing cancer. Others then, in the terms of more significant cancer, lose quite a bit of muscle and fat. Bone loss is a common side effect of the treatment. Range of motion, if the person has radiation, that's going to just have an effect on the connective tissue. Red blood cells, I mentioned, and immune function. Blood pressure and fatigue. So fatigue is the number one side effect. So if you look at those compared to the benefits of exercise, we could see that they have the most positive effect. So that was our sort of our assumption that if we could maintain and improve, but even just to maintain physical function and quality of life with our program, then that was going to benefit our participants. Okay? So exercise provides a distraction from pain and symptoms, a chance to feel healthy and normal, a chance to feel back in control, and the benefits in terms of relaxation. So today CBC did an interview with our program, and they interviewed 3 participants, and so it will be aired, I think, on Monday, but they were very impressed in terms of what the participants had to say about how just belonging to a group changes their quality of life. So that we definitely have seen physical function changes, but really their group dynamics, the way they feel, the relationships they develop within the program are really significant. So from 2002 to 2019, we've had over 2,200 participants through the program. Significantly improved because we do a pre-post evaluation. They're resting exercise blood pressures. They're able to achieve more work on a progressive exercise test. Their strength was improved, and their quality of life measured with the facet F, and previously the SF-36. Okay. So in 2012, which now seems quite a while ago, we did do a paper, but at that time we had about 500 people. So now the data is available that we're working on to try and divide up the exercise response between different cancer types. Okay? So people with blood-borne cancers are not going to respond the same as people with breast cancer or brain cancer. Okay? So we worked with the exercise professionals, so we assured that we have quality exercise professionals. We had a facility with equipment, and we had administrative support in place. We connected with Grand River Regional Cancer to get referrals from our oncologist, the supportive care nurses. So we needed not only the referrals, but we needed to have some education and some very strong partnerships with the regional center in order to move this program forward. We also relied on allied medical and health professionals. As I mentioned, they come with some other issues that as exercise specialists we're not able to deal with. So we have a process where we can refer them out. Additional medical clearance, lymphedema management from our OTs and PTs, and nutritional support from nutritionists that are registered dietitians that are specialized in cancer treatment. And we have in our Waterloo region, we have Hope Springs, which is our cancer support group, which helps families and caregivers cope. They have educational classes, they provide some encouragement and some transportation. So putting this all together is what's made our programs fairly successful. Okay. So from then, we were able to fund, and this manual is on our website. We wanted to target the older adult. We also wanted to share our wealth of information about how to start or how to develop these programs. So Health Canada was very interested in this, that was not all research-based, it was some best clinical practices. And we were able to put some guidelines together so that other people wanting to start a program would be able to follow some guidelines. Okay? And it's something that can cross multiple chronic conditions because it's a framework. Okay? So the one thing that came out of this is that the statistics for people with cancer over 65 is quite large. Yet we found only 12% of our participants were in that age range. So we wanted to know why we couldn't get that age range coming to our program to exercise, to gather the benefits from it. So any idea why we couldn't get seniors? I'll use 65, I don't know. Well, you're not supposed to answer. Sure, go ahead.
I think maybe transportation. We couldn't arrange transportation.
Transportation. What are some other barriers do you think for people over the age of 65? Yep. Finance. Okay. Gotta be more. If anybody worked with seniors, you're in an aging class. Come on. Okay. Anything? Okay, so there was a couple of other things. So what we wanted to do, finance for sure. So what we wanted to do, and we did for up until 2 years ago, or a year ago, is we had that program for free. Okay, so we're able to get funding from a variety of sources, including the Regional Cancer Center, that helps supplement what the Department of Kinesiology was already doing. So that didn't seem to be a barrier, although some people say if I don't pay for it, maybe it's not worthwhile. So it could have been a reverse barrier. Transportation, we thought that was it. So anyways, what we did is we went down to the chemo and radiation suites and we interviewed people. Have you heard about the program? If you have, is there any reasons that you don't come to the program? So it turns out the barriers were the university, that's this ivory tower, which the community feels, I can't come here. This is for young, healthy students. So we had to sort of break down that and say the university is to welcome our community members. The second thing was the group of people we interviewed hadn't exercised previously, so this would be something very new. So we had to do something about education. We also had to educate them about the sort of the benefits, I guess that would be it. They weren't aware that exercise would be beneficial. And if you think of it, put yourself in their shoes. First of all, you got the diagnosis. You're tired. You're taking chemotherapy that could be making you nauseous. It can provide, hair loss. For a lot of the women, they had mastectomies, so they didn't have breasts. So they didn't really want to go out into public. They were warned that their immune system was not functioning at full capacity. So going through these, we've got a list, and we were able to revamp our program. And so it turns out that the education was important, and we also had to change our brochures and our advertisement and keeping it simple and in languages and at a reading level equivalent to about a grade 7 or 8 so that they totally understood what was going on. Okay? So when we did all the changes that we could we did presentations to the group, we provided a better brochure, we encouraged some drop-in sessions, we provided ambassadors who were in the program. We ended up increasing our enrollment of people over 65 up to 35%. So a dramatic increase in how we approached getting referrals for the program. Okay, so back to assessments and where maybe technology fits in and how people can help advance what we're doing. So we have to do an assessment, and it's not easy to see probably, but we have to measure their heart rate on an electrocardiogram, measure blood pressure. We need to put them through a series of other tests, some balance tests, some range of motion. And once we've done that, setting up a program, they need to be monitored. Okay, so we currently use polar heart rate monitors, blood pressure, scales, step counters, and maybe some app on a phone that helps with understanding their posture. Okay, so there's just a couple of pictures. Here's two of the newer devices we have. So we have, and it's not the exact one, we use the CardioTech where we can put 2 fingers on and get a recording of the electrocardiogram. And then there's a variety of heart rate monitors, the Fitbits, the Garmins, all of which people have. They have a lot of technology. what our issue is that we want to have something that's reliable and reproducible. And so we've got into a situation where that might not always be the same with stuff that's in the market. Okay. So role of technologies: monitoring clients' medical conditions, heart rates, blood pressure, signs and symptom trackers, probably nutrition tracking, feedback on these measurements, education, and I know based on talking to Colin from the enTECH that they're now working in the resource center at Grand River Hospital in order helping people to do searches and to use technology, and data collection and storage. Okay. Does anybody have any other suggestions where we might be able to use technology? And then secondly, how do we use that with a population throughout the whole age range? Anybody? Is there any ideas of what you've used in the past? What about you guys that are doing it? What else do you do? Where else do you use technology in a population here? Where do you see a potential?
We mainly work with older adults. So
Yep. Well, we would have older adults, right? So our age range is probably from 20, but not as many younger ones, up to 88. Okay. Okay. So what would be some of the limitations? Certainly getting devices on and getting them operational. Okay. We found that as an issue. Helping them understand what really gives reliable data, because they will go out and invest in it, but is it reliable? And that's where the expertise of groups like enTECH really come into play. Okay, so moving forward then, so we have information and communication. So the information is what we want to share. Communication is how we share it. Okay. In all cases, we want people to be sensitive to how the participant prefers to communicate, learn, and use information. Okay. So based on our experience, these are just guidelines and pointers. We're not saying that they work for everybody. But keeping attitudes, feelings, and behaviors in check, because that can cause breakdown in communications between people of different generations. So I overheard one of our volunteers, he was working with a person, really friendly and everything like that, and say, "Hey, bro, how's it going today?" So, "Hey, gal," or "Hey, sweetie." So some of those things that are very different that you may, interact with each other, where sometimes the older generation doesn't take too kindly to that kind of stuff. Okay? Miscommunication can cause people to respond very negatively, and we'll see how that can happen. And I think a big one is not to leave the older person out of the conversation. Okay? So, a daughter comes in with her mother, say for even our stroke program, and we would talk, provided they had full interaction with the participant, not to the daughter and say, "So what are we here for?" Okay? It's a matter of talking and keeping them part of the conversation. They feel belittled if you're talking to them like you would the kindergarten class sitting in the front row. Okay, persons are at risk when information is not communicated well or fully. Okay, so really what we've done is starting with basic explanation, tell them the options, and give them time to figure out what's going on and to ask questions. Okay, so this one's for you. Soft skill, no, not yet, sorry. To be observant and to be social. Most of the information you should be able to pick up with people's body language. So I can look around the room and I can tell people that are engaged and people that aren't. Don't all look up now. I've been there before, you guys sitting in lectures. But you can see whether they're interested, they're distracted, if you're in a room that you can't hear. So again, the skills and being social are two things that are going to get people farther. So with our volunteers and with our staff, we ensure that punctuality is important. Appearance. Things have changed over the years in terms of what's acceptable and what's not. So dress is important, okay? And hygiene. At the heart program, we sort of insist that, I'm going to use this, it may seem not as relevant, but the girls wear full pants, not short shorts, because that's not how we want to put the heart rates of our members up. So, which is true. I mean, it's a just different generation, okay? So we have sent people home. We've sent people home from classes, feel like it is a little bit like high school, that have, revealing tops, short shorts, when they're working with an older population. With the cancer population, germs are, a real threat to them. Their immune system is compromised, so we ask that people wash their hands, disinfect when they enter the facility. And that's no different now when you go into hospitals. Okay? They may be super sensitive. We probably aren't quite as sensitive as they are, but they've been warned that their immune system is compromised. They're also very sensitive to smell, so we have to have a no strong perfume or cologne. The smell of coffee makes our cancer patients nauseous. So it didn't help when Starbucks got put in right beside our gym, okay? And that's where our waiting room is. So those types of things are very significant when we're working with participants. So we don't bring our coffee into the gym when we're working out. And we do have to put up signs about perfumes and colognes. Okay? And a big one, and I know you guys are so used to it, and you're always checking phones, whatever, but they find it very offensive if in the middle of working with them or supervising, people pull out their phone and check their email and, whatever. Okay? So those are some of the skills and professionalism that we endorse. And trying to stay focused on the task. We're very fortunate to have student volunteers that are absolutely amazing to have. The participants thoroughly enjoy having people work with them because they're so uplifting, they're happy most of the time. And so we try and encourage them when they're there to work with the participants and not to gather or cluster with each other and chat, okay? Again, the feedback comes back to us about performance of volunteers. And it also has happened with staff. None of the ones we have currently, but we've had to reprimand them. Yep.
Just a quick question, Caryl. If we were interested in being involved,
yep.
Can you just give an overview of how we would get involved to be a volunteer?
Okay, so from the very first page, the CARE web page, it's called CC Care. It has a volunteer, and what people do is go in and fill out the forms and indicate their availability and what program they'd be interested in volunteering. Yeah.
Any other requirements?
No, we do have a volunteer training workshop so that we go through things, exactly this, and then there'll be training with the specific exercise, how to help people with heart rate monitors, and then really to be observant. Because if something's going to happen, you can usually tell. If you look at them and they're, sort of a blank stare, they're staggering a bit, they obviously are having some type of issues that need to be dealt with right away. Okay? We've had people fall. We've called 911 many times. But it's really to be observant and prevent anything catastrophic from happening. And that would go across the board to any senior group that you're working with, is to really watch and prevent anything from happening. Okay, so here's an example of something to be watching for. Okay, so this guy obviously has hearing problem. So their sign language or their body language is going to tell you. Okay? Other people will say to you, I have a hearing aid, could you talk to me on this side? Okay? So again, being observant, finding out what's going on. Here's a typical one, and you don't have to be that old, is the visual. You guys are great. You have cell phones or watches that you can read the print on. 99% of people over 60 have difficulty reading those things. So again, when you're setting up their phones or helping them or providing written material, make sure that they're able to read it. Okay. What does that sort of signify? Anybody? Yep. Sorry? Could be fatigue. Confusion. Yeah. So I mentioned chemo brain, but we have another program, Brain and Body, which is mild cognitive impairment. And when those things happen to them, it's frustrating for them too. So one of our person who has progressed with a little bit more dementia still comes to our program based on having a ride and someone to pick her up. But the other day she came without her running shoes. Now she came from her house without her running shoes. When the driver asked her to get her shoes, she goes, I already have them. Okay, so she comes to the program without running shoes on, without any shoes on. So again, so there's this confusion or mild cognitive impairment that really you have to then be sensitive to and in the moment respond. Okay? What about this situation? And this really one has happened too. So what's going on here?
I guess different terms that have come along throughout the years, they think of it of a different way. So if we set a virus on a computer, they think, is the computer sick? They're like,
yeah. Well, not even that. Yeah, that's exactly it. So when you say you've got a virus, their mind's thinking, I'm sick. What's wrong with me? Can you explain it? So this really happened. It was in a senior's home, and it was actually one of my friends. And she was with her mother, but she happened to be on the phone talking to another friend, and they were talking because, she said, well, you gave me the virus. It came from you, and so they're going back and forth talking about a computer virus. My friend gets off the phone and her mom goes, I'm really disappointed. You haven't told me about your health concerns. You're sick and you're sharing it with your friends, but you're not telling me. And they were talking about a computer virus. So again, it's a warning on the language we use or the interpretation as we get a little older and don't have. So I can imagine you have all these short forms like LOL and, things like that, but they don't know what they are. I don't know what half of them are. But again, being very careful in the language you choose to communicate. Okay, factors that lead to breakdown in communication then are hearing. So besides, if you're aware of it and you can talk to them, and you guys might do it, might be selective hearing, but you just get blank stares. So you don't know whether they're understanding. So you need to then encourage them and ask the questions. Did you understand what I said? And getting some feedback. Declining sight or vision, declining memory. So if they ask you the same thing 5 times in a row, how are you going to respond? Inability to read or understand, and that can be different languages itself, or just the level of their reading and development levels. Emotional state. It can be anywhere from depression and anxiety to the cognitive impairment. So they can get very agitated. They cannot be focusing, but those types of things, again, you would probably have to deal with. Types of information being shared, understanding of the issue or the topic, the environment. How can the environment help? If you're, let's just say, because we're talking about technology, you're trying to work with someone and setting up their email, how is the environment going to affect them? What are some situations where the environment would affect them?
So this is from our experience dealing with older adults at the old folks home. We want them to be in a quiet area where we can communicate with them. So usually we're in a communal area, so we got nurses and people running around because they get distracted. So we want to get them into a quiet area. Good.
Yeah. So again, bringing someone into an area where there's not as many distractions going on really helps. Okay? And personal style, such as use of body language, tone of voice, choice of words, and speaking pace. Those are all things that can lead to breakdown in communication and not getting your message across, or in the case of your group, not being able to help them to a level they would like. Okay? So being understanding and aware of possible signs of chronic disease and aging, which are changes in cognitive abilities, physical abilities, sensory, emotional behaviors. So group there. So something I'll go back to that. Something then I'd ask you, so what are some challenges that you have or might have encountered that tries your patience? So we're going to talk about exercising patience and compassion. So what things may challenge you? And you can think about your friends, your siblings, or your parents when you try and teach them. What things sort of challenge your ability to remain patient and understanding? Yep.
Like when you think that somebody should know something that they don't, like you forget that you know more than they do.
Good. So that you don't understand that they don't know as much as you, or you think they should understand it, but they really don't. Very good example. Another one? So what are some things, you must have encountered this, that lose your patience?
Teaching my grandpa how to use an iPad.
Okay, good. Yeah. And what's so frustrating about it?
It's more I have to be patient with the fact that he hasn't like ever used an iPad before.
Yeah.
So I have to take that in mind and like understand that it's going to take a while until he truly gets it.
Yeah. So having to repeat things a lot of the times and have them not push the keyboard like they do a typewriter, right? So a couple of things that physical challenge, if someone's very slow to respond, right? If they're trying to move and you're going like, I got this time. So might try your patience. Any other physical challenges? Forgetfulness. You know, I just told you that, you know, because it gets very frustrating. Neediness and people that are apathy, you know, I don't really care. So they're sitting there and yet you've got a job to do. Okay? So during these moments, put yourself in their shoes. Oh, I understand they're going through chemotherapy and they must be really frustrated. They're upset. You know, parking attendants just put a parking ticket on their car because they forgot to put their parking pass in. Or in my case, my daughter came and took the car out of the lot and security saw her do it and I get the fine. So have patience with these people. Ask instead of order. A person comes into a resource center at the hospital to get information on lymphedema. What's your approach? You've got a cancer patient coming in now. It's about them, so, and it's not necessarily the technique, but what are some things you're going to do? Okay? What's your first approach? Yep.
Maybe ask them exactly what kind of lymphedema they want to know, exactly the reason why they want to research.
Yeah, so you're going to ask some questions about it, right? So you're not going to tell them what to do. You're going to inquire and get them involved. So good. Asking questions offers a person a greater sense of respect. Offering options and giving them some sense of control. Okay? So again, putting yourself in their shoes, you just want to know, you know, they ask some questions, they'll get the information out without telling them this is what you're going to do. Okay? Ask instead of assume. Okay? So asking questions instead of making assumptions when it comes to your actions in relation to the older adult. So an example, I'm going to open your email so you can read your messages. Better approach. Let me show you how to open your email so that you can read your emails. Okay? So ask instead of assume. Use I instead of you language. So many people generally don't respond well when they feel like they're constantly being told what to do. And you can all relate to that. Okay? So bossy people often then really breaks down the communication. So instead of saying you will or you need to remember to close your email, you're going to say, let me show you how to close your email. Okay? So using things like I, it, we, let's, and this is better than you will do this, or you need to do that, and you need to go have your meal now, or you need to take medication. Offer choices whenever possible. Many adults, they want to maintain some sense of control. So give them some options and let them choose. Again, coming back to not being told what to do. Okay? They have a greater sense of confidence, self-esteem, and security. Because again, we don't want to take that power away from them or their sense of belonging. Okay? So to finish up, this is from a paper that talks about sage advice. S is for simplicity. Instead of technical and medical terms, and this is the same in kinesiology and I'm sure in health, don't use a lot of jargon that people would not be familiar with. Okay? A, assure. Don't assume older people are deaf, dumb, and blind. Assure them that by communicating with kindness and involving them in the conversation. G is for give information. Help older people make informed decisions by sharing information in the way they prefer. You may have to write or demonstrate something in order for them to understand. Showing people for our exercises, repeatedly showing them how to do it, but having something written down. Ease is for ease into it. Avoid starting with too much, too quick. An example with exercise, again, I'm sure you can think about it. With other things is that we can't tell them to, bend their knees, protect their back, pull their shoulders back, suck in the stomach. Like there's too many options for people, and if you stop bombarding them, they're not going to do any of them. Okay? Sage and advice. A is to acknowledge. Instead of overlooking older people, recognize, engage, and listen to them. D is for discovery. Just because someone nods their head doesn't mean that they understand. Right, you guys? Ask older people questions if they truly, so it shows that they truly comprehend. V is for value. Avoid using over-friendly terms and baby talk. I gave you that one example. I is for individualized. Acknowledge their language barriers. Be sensitive to one's values, cultural beliefs, and changes associated with natural aging. C is for communication. Avoid telling people what to do. Instead, focus on what is most important for them to know and consider, and make sure they understand what's required of them. And lastly, E is for empathize. Try to understand a situation with the older person's point of view. Think about yourselves, but also think about if it was your grandparent or your parent, and put yourselves in that situation. Be sensitive to the situation and the challenges that face them. Okay? Hopefully it's an overview, some things that we've learned about and developed over time. And if you have any questions, I'd be happy to answer them. Nope. Okay.
So we just want to present you with a gift.
Well, thank
from
you very
us.
much.
Thank you for coming
Thank you.
and sharing your experience with us.
No problem.
And that's it, guys. We're done.
Yep. If you have any questions or if you do want to volunteer or learn something,
Come on up.
come on up.
Thank you.
Hi.